Hey everyone, I'm Dr. Del Rosario, a community oncologist passionate about uncovering the truths of cancer care. I started this series to debunk common cancer myths that cause a lot of fear, confusion, and frustration with patients and their families. With years of clinical experience under my belt, I found that a lot of these myths can cause a lot of damage, and I wanted to try to fix that. My goal is simple: to teach patients, families, and their caregivers how cancer works and to make better healthcare decisions for themselves today. So whether you're a patient, family, or just curious about what cancer is, hopefully you'll tune in and learn something and make a better healthcare decision for yourself today. So today we're busting a common one. Do biopsies spread cancer? And let me break it down for you. No, they don't. Biopsies do not spread cancer cells and are in fact very important for the diagnosis and treatment of cancer. People worry that if a needle goes through the tumor, that it's going to spread the cancer cells along the needle tract. This belief comes from the understanding that when you poke something, obviously it's going to disrupt the architecture and possibly spread the cancer cells, right? Well, the reality is that modern biopsy techniques have been designed to minimize this effect. And today we'll get into how oncologists manage these procedures and why they're safe. So where did this idea come from? The idea that the biopsies cause cancer spread originated from a few cancer cases that were documented early on in the medical literature. This was way before modern science techniques and sterilization. In these cases, cancer cells were found along the tracks of the needle when it passed through. So for example, if you took a needle and you biopsied like a breast mass, the very small, minute cells were found along the needle track. Well, however, these cases were never replicated and were only found early on in the literature. And today, modern biopsy techniques found that you don't have this kind of situation happening. We have much stricter protocols to avoid any such risk. Unfortunately, the fear persists because people often come across information from other people, and word of mouth, if you ever played a telephone game, if you hear the same thing over and over again, eventually it's going to get construed into some kind of fear-mongering type of myth. So if this happened a long time ago, why does the myth persist today? Well, a lot of it has to deal with the fear of cancer, and that's why I'm here. I'm here to teach you that the cancer is changed a lot since back then, and there are a lot of modern techniques and modern ways of treating cancer that will debunk much of these myths. Another reason is something called confirmation bias. Some patients associate the worsening symptoms with the biopsy itself. So I've had this a lot of times when I have a patient come in, they just had a biopsy. Obviously, if you have a needle stuck in through your chest, it's going to hurt for some time, kind of like a bruise. Some of these patients, unfortunately with cancer, that cancer is asymptomatic at the time when we find it. And when you get a biopsy, you develop symptoms like pain and soreness, tenderness, and you're like, wait, did you start the cancer? Did the biopsy start the cancer? Well, actually, no, it's been there all along. It's just that we're trying to figure out what it is. Science says that you've had multiple hundreds, if not thousands, of studies with biopsies, and it hasn't shown that biopsies spread the cancer cells. In fact, getting an accurate biopsy is necessary and mandatory for cancer treatment. Modern techniques actually minimize this. We use a lot of different imaging techniques, something like a CT guided biopsy where a patient would go under a CT scan and they would mark with an X exactly where the best spot for the needle to go through to get a sample of the mass without damaging any other architecture. Oftentimes, the surgical teams often remove the needle track if needed during follow-up procedures. So when they would put the needle in, they would make sure that it's all removed and make sure that everything is closed without any spread of the cancer. Another thing that we do these days are sterilized techniques. We have a lot of different protocols in sterilizing the needle tract, as well as sterilizing the above and below of where the needle went. So that goes into show that biopsies don't spread cancer. What's more important, though, is biopsies are very necessary for the diagnosis of cancer. A lot of the times I tell my patients that whenever you have a cancer diagnosis, you always have to answer two questions: what kind of cancer it is and where did it go? And in order to answer what kind, we need a biopsy. And in order to biopsy, we would need to stick a needle in and actually take a piece of the sample, send it to the lab, have the pathologist read it, and run some tests so we get an accurate diagnosis. The reason why this is very important is because there are hundreds of different types of cancers these days, and there are different types of treatments for different cancers. We have chemotherapy, radiation, surgery, immunotherapy, hundreds of targeted therapies, and the list goes on and on. So getting an accurate diagnosis is very important and mandatory for treating cancer. So in conclusion, biopsies don't spread cancer. They provide information needed for effective treatment. So if your doctor recommends a biopsy, it's because the benefits far outweigh the risks. The myths that biopsy spread cancer cells is long outdated and has been disproven many times over a period of different studies. So if a doctor recommends it, I strongly recommend it as well, because getting more information is more than half the battle in treating cancer. All right, everyone, thanks for tuning in for another episode of Oncology Mythbusters. If you like what you heard, please like, subscribe, and follow for more. And next week, we're going to go along the theme with discovering why cancer isn't contagious.